Hello everyone, I'm going to talk about leukemia, and leukemia is the body's blood-forming cancer cells, and that could include bone marrow, the lymphatic system. The reason for the name is because this type of cancer produces abnormal white blood cells in the bone marrow, and the lab to look at is the leukocytes to determine which type it is. And it can also affect the hematopoietic and lymphoid tissue. It's classified by the speed of the progression and the type of cells involved, such as prognosis. And the two most common types are acute lymphocytic leukemia, which is ALL, and that is most common in children, and if adults do get that, it is very dangerous for them. And acute myelogenous leukemia, AML, is it can happen in children and adults, but it is most common type of leukemia for adults. Some risk factors include if you already have had cancer and you've received chemotherapy or radiation, that puts you at a huge risk to get leukemia. Or if you have a genetic disorder, you smoke, or you have a family history of having leukemia, those are also risk factors. And the diagnosis is blood test and a white blood count check, a platelet check, and you'll probably have to have a physical exam and a bone marrow test just to see if it is in the bone marrow. And treatment would be chemotherapy, radiation therapy, and now they have stem cell transplant, which is kind of new, so that's really nice. And 387,000 people live with leukemia in the United States currently, and every day 170 Americans are diagnosed with leukemia, and 67 die from leukemia a day. So it is a pretty serious disease. Thank you.